So we've called to order. Director Jeffries is unable to attend, so we have Director Canseco. We don't need to do a roll call. Hi. So we'll see any public comments. We have no public.
No.
Received nothing via email. So we could go straight to discussion items if you'd like. For a 2 items.
Did we hear the recording?
Yes.
Okay.
So annual report, again, I'm starting a lot of meetings still with context and background for you just to catch up. At which point tell me like, yeah, I got it, lady, and I'll stop. Okay. So annual report, we pretty much start around the August, September timeframe because we like to align it to be able to demonstrate last year's financials. We don't usually get those until this time. So that's why you don't see it start at the beginning of our fiscal year. And we do align it with our fiscal year. So annual report doesn't align to the calendar year, which messes everybody up, which is fine. I don't know. So last year was the first year that Jasmine got to own the annual report. She did a great job putting it together. Typically what happens is the chair will write an intro or provide some quotes or something about the intro. So each year we will try from a staff standpoint to identify a theme or particular benchmark, something that we want to really talk about. That's been a little bit easy to do because obviously all the programming has just started. So there's been great stuff to talk about. So then at that point, there's usually a couple of pages related to district financials, where the money has been spent primarily. I like to make sure that that's clear to anyone who sees the annual report of this much goes to administration, this as much as programming, so on and so forth. Usually there's some good feel-good pieces about programming. Either we're talking about diabetes prevention program or community resource navigation programming. We try to keep it relatively slim. The first couple of years that we were doing them, they were much more dense because we had a lot of history we had to talk about. We don't do quite as much of that now. So it's usually maybe 6 pages front back.
I think so, yeah.
That sounds about right.
Yeah.
Okay.
Maybe max 12.
Okay. So we will actually have a number of those printed, and then we have a digital copy as well. So that's just underway. We don't have anything specific to report on it.
But it's there.
We're working on it.
Yes.
Yeah. So it's something that we do every year. It's not really mandated to do it the way we do. We could just simply say, here's a year-end set of financials or something. But we'll try to use it a little bit like a marketing piece for maybe partnerships more than anything. It's not really a marketing piece that people get super excited about.
Yeah.
You know. But it helps for any potential partners to see what we're doing. And then occasionally we get community members who are really interested and they want a copy. So that's it. Any questions on the annual report?
Is it the same one that came, I think when I was on board, there was a little pamphlet with all of that numbers and funds?
Yes.
All of that stuff, so it'll be that
Yes.
similar to that.
Same idea.
Okay.
Yeah. Again, it gives a little bit of notable activities, review of the financials. Is that it?
Okay.
But it takes a lot of time. So it's one of the things that sits on Jasmine's docket because how I used to make them isn't as nice as someone who's more professionally skilled in those. So now she owns it. Yeah. Any,
So will this be the second year that where it's more like nice, not nicer, but more program based?
for programming
Or third.
base, I would say this might be the 3rd year, because I think the first year we started talking about a few different things that you put forward. But this will be the 2nd year that Jasmine will put it together, so we'll have that more Polished.
You did pretty well.
I just am wordy.
You are winning.
I get wordy.
There's a shot, right?
No.
Yes, you are.
Oh, it's because I've lost the screen. Sorry. I lost whatever I had up there
When you dropped your mouse.
when I dropped my mouse. There we go.
Anything else on annual report, questions, thoughts, anything? Nope. Okay. So the second one, item B, is the ACHD presentation regarding community resource navigation. So ACHD annual meeting every year, they'll put out a call for best practices, programming, something like that. Last year we presented on the diabetes prevention program. So this year we thought we would present on the community resource navigation, Katya's position, right? We knew it would take a couple of years, and she's been year and a half full steam ahead now. I think it was mid 2023 that we hired her.
She's been here longer than that. 'Cause
Yeah, but
she-
we didn't launch her into the community for at least 6 months.
The community thing hired.
Yeah,
Launch, I don't know, Teresa, when did we launch her? I was gonna say hired, I knew it was more.
I
than
know we
2
just
Yeah.
looked at it, but when we got Katya here, because it was a brand new position,
Yeah.
we had her really start developing her resource lists and getting connected to resources for about 6 months before she started meeting with clients. And that was so that we weren't frustrating her or others with her not being able to get challenging situations put together. So we've got, now I think it's about a year and a half worth of solid data of who the clients are that she sees and the kinds of problems she's working with them on. Still, number one concerns are things like housing, which there's limited resources on. Obviously, she's had a lot more requests for legal immigration related support. So she's created a network, just developed a network, I should say, of legal aid, immigration, and other immigrant related social services that she can then pipeline folks through. So there's a lot there. And then I would say from the most recent thing, one of the main activities she does is help people with applications. Whether it's Medi-Cal, SNAP, those kinds of basic. They can be complicated if you don't have a high literacy or if you have a language barrier, or if getting to county agencies is very difficult and you don't have a digital access. She's really able to help folks with that standpoint. And we're seeing that across the board. We still see a fairly large number of seniors or adult seniors, even though we do have the Foundation for Senior Care and their advocates. So we're still seeing a lot of cross action in that direction.
So they're calling to get resources instead of calling.
The Foundation for Senior Care. Yeah. Or the Foundation for Senior Care will refer them over to us because maybe they have an adult child and the foundation doesn't really work with that. Or I don't know, there's been a number of things. For a long time, anyone that was Spanish speaking that called over there, they referred to Katya because they didn't have anyone Spanish speaking. So I think that that's where we saw a lot of that. We're paying attention to that because obviously if that's something we're grant funding, the idea was never to duplicate the same service, but we're seeing a need there, so we're paying attention to it. So that presentation, I actually just sent a couple of edits back to Jasmine, but she's already got that slide deck put together. Once we've fine-tuned it, we'll bring it to the board so the board can see it as well. And then obviously we'll be presenting it at the end of September at the ACHD annual meeting. Anything on that? Did I? No? Teresa, anything on Katya's position, the reporting?
No. I mean, I think it's gonna be a great presentation for the other districts because it's something that's so applicable. And even if you're not a health district, let's say you're a water district and people aren't paying their bills, to have like a, like a resource navigator, it just has a lot of, I mean, this is for health districts, but I mean, it just has a lot of appeal. We applied for both associations. Yeah, so this is the one for the health, but it's something, so many could benefit from. So
Right.
I think it's gonna be well received.
So it'll be interesting to see and as the position continues to develop, right? Katya,
Is she only available during the time 5 to 8, right? Or 8 to 5?
we do 9 to 5 is our main office hours, but she's here later on Tuesday evenings.
Okay.
And then she does a lot of kind of by appointment stuff. So if somebody's not available and they've reached out to her, she's usually been fairly flexible to be able to meet and work with
Mhm.
folks. So that'll be a position also that we'll watch
Yeah.
as we
to
go
see.
forward to see. Right, so if there's a lot of demand,
Mhm.
you know, that one Saturday a month when we're open right now. If her schedule has to get flexed where maybe she's meeting a few, then we'll find out. So far, that hasn't been the need. She's still creating a lot of relationships with the schools, and I think that has been
Mhm.
really handy, especially out at Vallecitos.
Yeah, just strong connections with Fallbrook Elementary
Right.
School District as well. Yeah, yeah.
So we're with most of the nonprofits in town. I know she's still got a reasonably good relationship with Food Pantry, Foundation for Senior Care. Turn Again, is that the affordable housing apartments over here?
Yep.
So a lot of those folks who are likely to come with more advanced needs,
Mhm.
as well as just some basic needs. Making sure that folks can get connected to that. So it's exciting to see that position grow.
Mhm.
Anything else on? That's all we got on that. Well, what else we got?
We got Jasmine's report. You wanted to talk on that or anything else?
I don't.
Pull it up.
Might as well, yeah.
Just my usual report that I always do kind of every month, which we just reports on social media, email marketing, as well as any sort of outreach events that we've done for July and June. Off the top of my head, there was a slight dip in website traffic. And I think the reason was it was still kind of summer, people were coming back. So we saw a slight dip, but August has been very busy. I think right now we're at 100,000 website visits. So definitely a lot of people are coming back. Summer's officially over. Everybody's getting back to their usual routine. Social media was doing really well. We got a lot of good organic traffic. Facebook still is our primary one that a lot of people use in terms of getting the most engagement compared to Instagram. But we did see definitely, I noticed an increase when it comes to people clicking on the link that we have in our bio, which takes them to all different parts of our website, from the Wellness Center calendar to just signing up to our newsletter, to getting information on the board and committee meetings. So it definitely got a lot more clicks, because we used to get like 0 to 1. I think now we got like 7. So I'll take that. So at least people are clicking. And then in terms of outreach events, I think that month, I think we kind of only have one. Yeah, which was the Fallbrook Family Health Center. It was their backpack giveaway and resource event that we've always supported and always attended every year, which always has a good turnout. A lot of people come looking for needs, and so I always normally take Katya because it is definitely a heavy base on Spanish speaking because it's their clientele, but also a lot of people just figuring like, oh my God, you do this, and she's able to sometimes meet potential clients as well as some of the other organizations that are there, introduce their clients to Katya. So it's kind of a good way for her to also network and connect within. In terms of social media and press releases, that month we did the community health contract grant. So that was our big press release with the lovely big checks that Village News posted. And then just updates on the award and speaking submissions. So for CSDA, that award, which we submitted Katya's position. Unfortunately, we're not selected as a finalist for the 2025 year. Which that market is very competitive because it's all special districts.
So many water districts.
A lot of water districts you're competing with everything. So they're very sometimes, it's a fierce competition. And then we have ACHD, as Rachel mentioned. I did have a deck created. It was now just fine tuning, doing little small edits. But I included the lovely date and time, which they're presenting September 25th from 2:45 to 3 p.m. at the San Diego Sheraton. That's my report.
And then I'm gonna venture to guess the next meeting we'll see a lot more social media traffic because we have the vaccine event, vaccine
Has it
hesitation.
the food one, the kid school lunch?
Oh, packing
Yeah.
lunches?
Yeah,
Yeah. So I think that might be interesting. So just on a side note from programming standpoint, Teresa's been able to finalize a few agreement contracts with some different providers. So I think some of the programming coming into the fall to next year is going to be really exciting. A little bit different, a little higher end than some of the things we've had in the past. Is that fair to say?
yeah. Well, we'll be able to do more in Spanish. So one of the new contracts that we have is with a woman named Shirley, and she's a community health worker, but also has done education. So she is going to be doing our diabetes self-management, which is you already have diabetes. Now you got to control it to prevent all those complications from occurring. And so it's a completely different animal than the pre-diabetes. There's a lot more involved. So she had worked with Scripps. So she actually rewrote their program, Project Dulce. So she's really good at like creating things and the healthy, lunch box program. I expressed, like an interest in an idea, and she just like nothing had like a whole, program for that put together. So, and she can do, she is bilingual. So that gives us that's what we were missing was that piece of somebody that, what could do things more than, a partner that just has these lists of presentations. But that, could be a little bit more engaging and is bilingual. So we brought the diabetes self-management in-house. We had been using partners. And so that'll be, like really good to be able to have it in Spanish and some consistency in that program. So, and we are doing a lot of programming that's going on, like in Spanish. Jasmine knows because she has to work with trying to translate everything coming up. So we're excited about that. And then some outreach. So we've been trying to get in front of groups so that we can win some of that trust by working with another organization that's trusted. So we just met with Hope Clinic with some of their families. It was adorable. Like all these little babies were so good and just sat and played and listened to everything. So that was really, productive and a lot of interest in the diabetes program from that group too. But we're speaking on Friday to the local church, a local Hispanic church. So that's taken a long time, to put that together. So we're excited to start seeing hopefully, some more engagement and really grow our email list in Spanish so we can, start really building that relationship over time. So. Good.
I was just checking I had asked Jennifer if she had any specific comments to make. And not really asking you about how to invite more Spanish speakers into the navigation tool. So I think she feels that we might be underutilizing some of Katya's skills, but I think that over the summer it was quiet because a lot of those kids, a lot of those families come in through the schools. And if they're not engaged in school, then they're, it's not coming in. But if, again, it always comes back to if you have connections into a lot of the Spanish speaking community that may be not mainstreaming for resources, to make sure that they know that we can be that resource at least.
Mhm.
I think that's what she's referring to. Asking you to be our liaison, so to speak, yeah, obviously. But I mean, I think we asked that of all the board members for any groups that they're part of, whether it's a social group, another nonprofit, parent groups, all of those pieces. Having that connection is helpful. You are the only one who's a parent of underaged children.
Oh, okay.
So you get to serve a whole bunch of categories like young
Yeah.
family,
Mhm.
kids, right? Because no one else has kids.
Yeah.
That are young,
Mhm.
you know, I
Yeah.
mean, Howard's grandchildren are even older,
Oh, wow.
right? They're,
Yeah.
I think, going college level. Jennifer's college level as far as her connections overall. Cindy has no kids. Sally's kids are grown.
But no school.
Yeah, no grandkids. So again, you get all the buckets. You're like, I didn't know I signed up for that part. Didn't know. We didn't know.
Well, I guess to that note, to Jennifer's thing, we are waiting to schedule a meeting with BCC's Leisures program. So we will have a couple of those, I think they're women and gals, but you know, like those to go out in the community and promote on our diabetes education. So we will be doing a formal training with them together with Skinny Jeans so that they can kind of be our advocates in the community and have a better understanding about diabetes, what people need to do, how to refer to us. So I think that will be, you know, kind of like a next level for us. We haven't, you know, had that kind of support.
Community CCHW? Is it CCHW?
Mhm.
Okay, community.
That was for,
That was for VCC.
Oh, you said VCC. Thank you.
yeah, I
Thank
know,
you.
there's so many acronyms.
Some
Cs.
Yeah, the CCHW is our meeting that they hold over there and convene a lot of the providers.
Mhm.
But, and VCC is part of that, which is good.
Mhm.
I only have one question. Do you guys do, when there's special help, like the month, you know how there's awareness breast month and all that stuff? Are we figuring out things to also bring in the community during those months that are coming up?
Mhm.
Especially through the fall, I think we have a few ones. And since we have families too, I know there's more awareness also with the autism and all of those other part of health related things that are coming up.
Mhm.
Do you want to speak to that calendar creation?
Yeah, you know what, I'm remembering it like right off the top of my head, but we do look at that each month, and when we try, you know, to match it, for the Wellness Wednesdays, a lot of times that topic or something else during the month, so we do look at that,
Okay.
each month. And I think next year we're gonna get more defined about what things are things, you know, like moving forward, like, you know, for the different months. Sometimes it's been, depending on partners and what we were able to do, sometimes that might have swayed, you know, like, because each month there's multiple things.
Yes.
So sometimes that made the determination, but next year we're gonna try and come more to solidify, like, what are the things that we can really stand for in terms of those awareness months.
Yeah, and again, part
The
of
health
the,
ones, yeah.
Yeah, the
Yeah.
health ones, yeah.
yeah, part of the strategic, priorities that
Mm.
Jennifer brought forward at the last meeting is really trying to make sure that we've got some more family programming, things of that nature. Again, it always circles back to this development of partners who
Mhm.
can bring the right information out.
Mhm.
There would be nothing worse than, touting information about something that we know nothing about or have no resources for. So we're trying to make sure that we're building that very concisely so that we're not offering something that really isn't helpful.
Mhm.
But there's definitely been a lot of conversation about that in this last year,
Mhm.
a lot. So your perception of that is straight on
Yeah,
target.
so people, sometimes I feel like, especially families too, when there's a cause, I guess you would say, for that month, they get on board more faster than it would be, another, when it's breast Cancer
Cancer.
Month, you know,
Yeah.
how big people are involved.
Everybody's wearing pink.
Yeah, so I mean, finding those that fit our community one, and then, you know, fit that target that our strategic planning is targeting too. Is
Yeah.
also the social media.
Yeah, we, Teresa, myself and Bianca had a fairly in-depth conversation at the start of this year when we do all of our kind of resets. And then Teresa and I have been having follow-up conversations about really making sure that our calendar is aligning with the priorities.
Mhm.
And then B, what are those health things that fit in there? That gives them not only a focus, finding out who the partners are, but then it also is a little bit more cohesive marketing plan so that Jasmine isn't bouncing from topic to topic. We can have a little more consistent conversation. Because we were a little bit all over the place for a while. Because we were bringing up any programming we had, right?
So you have to try everything.
We splash it.
You have to see what fits and
Right.
what doesn't fit.
Yeah.
You do.
So, but just keeping that in mind and keeping it front and center for planning
Mhm.
is helpful. Okay. That's all we got. You got anything else?
I don't think so.
Mhm.
Okay, well, unless you have anything else, you can adjourn us.
Adjourn us at 5:54.
Yep.
Yes,
Yeah.
thank you. Great meeting. Thank you. Thank you.